to the next paper that will be presented by Dr. Xiaotao Lang. Sorry?
It's this one right here.
Oh, sorry. From LEUNG, okay. There's a misprint, sorry. The title will be, okay, sorry, Outcomes of Reintervention for Laparoscopic Transperitonel Pyeloplasty in Children.
Good morning, I'm Jessie from Hong Kong. It is our privilege to share our research with you today. So we have nothing to disclose. In our study, we evaluate the outcomes of reintervention for laparoscopic transperitonel pyeloplasty in children. There is a total of 46 patients who underwent laparoscopic pyeloplasty, and 10 of them, that is around 22%, developed complications and required reintervention. And in our we divided the patient into basically two groups. 4 patients had urinary diversion, in which 3 had insertion of double J catheter, and 1 had endopylotomy, and 6 patients were the redo group, in which there are 3 who underwent laparoscopic redo, 1 underwent laparoscopic assisted redo, 1 had open redo and then robotic redo, and 1 had anastomotic leakage and had open redo twice. The indication for reintervention included a deterioration in the differential renal function, progressive hydronephrosis, or symptomatic patient. And the choice of the redo procedure or reintervention is based on individual surgeon's preference. So for the outcomes of this subgroup, the redo pyeloplasty group had a better drainage rate, 50% compared to 25% in the urinary diversion group. And in our subgroup analysis, for the laparoscopic redo pyeloplasty, they had the best outcome with 100% success rate. And there was a 11% of median improvement in differential renal function for the redo laparoscopic group. The urinary diversion group has less promising outcomes, with only 1 patient with endopylotomy had successful drainage. So to conclude, ladies and gentlemen, laparoscopic transperitonel pyeloplasty is safe and feasible in children. Redo pyeloplasty is a more favorable reintervention when compared to urinary diversion in our series. Redo laparoscopic pyeloplasty has the highest success rate of 100%. Thank you for your kind attention.
Thank you very much. Any questions? Who is experienced with redo pyeloplasties? Okay, so short question, what is your impression, what is the reason to have a, let's say, restenosis or whatever, leading?
So in our study, we actually try to identify any risk factor for failed pyeloplasty, but we are unable to find one. But in our literature research, there had been proposed that, for example, a younger age, less than 6 months, may be a risk factor. But however, the group of patients with failed pyeloplasty is pretty much small, because the success rate is quoted as above 75%. Most series were able to achieve above 90% rate of success, actually.
Okay.
Were there any other factors that contributed to the decision to do the diversion as opposed to the redo?
Well, that's the limitation of this study, is based on individual surgeon's preference.
Okay, thank you very much. We have to move on.